Well, good morning. On January 5th, our government put in place additional public health measures to blunt the transmission of the Omicron variant. At the time, we were seeing very concerning trends emerge. Cases were rising steeply. Percent positivity nearly hit 40%, 10 times higher than when Omicron was first identified in Ontario. Hospitalizations were doubling every 7 days. The data was clear. We needed to act. Today, we know it was the right decision. Percent positivity has now dropped to 15.9%. New admissions to hospitals are starting to slow, and patients are spending far less time in the hospital when admitted. And our health system workforce is stabilizing, with more people coming back to work than calling in sick. As I said at the time, while necessary, the additional measures were always intended to be time limited. They were one more tool to blunt the spread of Omicron and protect our hospitals. The evidence tells us that these measures are working and that we can expect recent trends to continue as Omicron cases peak this month. And while we can be confident in how far we've come, I want to be crystal clear, we're not out of the woods yet. The coming weeks will continue to pose real challenges, especially to our hospitals. But these are challenges our hospital system can manage. We can be confident in our ability to care for people, to provide hospital beds to those who need them, and we can be confident that the worst is behind us as we look to cautiously ease public health measures. As we do, Ontario will repeat the success of the past reopenings. We're taking a phased approach with 21 days between each step to make sure we haven't moved too fast. Starting January 31st, businesses in Ontario will return to 50% capacity. For the first step, arenas, concert venues, and theaters will be capped at 500 people. Social gatherings will increase to 10 people indoors and 25 people outdoors. If trends remain stable or improve, Ontario will move to the next step on February 21st and then March the 14th. Minister Elliott will provide more details on what's included in these steps shortly. But before she does, I know there'll be some who wish we could move faster. As I said, we need to remain cautious, especially with students going back to class this week. And I know there may be some who say we're moving too fast. Now we want to be absolutely sure these positive trends continue as we move forward. And we want to do everything humanly possible to avoid having to go backwards. If that means pausing between steps for a few extra days, we won't hesitate to do so. The best way to make sure we keep moving forward, the best way to protect our progress is by getting vaccinated. If you haven't already done so, please get your first or second shots. And if you're eligible, boost up as soon as you can. Because so many of you have come forward for your booster dose, Ontario leads the country in third doses. This is fantastic news and something we should all be proud of. But it shouldn't stop us from wanting to do more to protect our families, our communities, and our hard-fought progress. So please do your part, get your shots. It's never too late. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good morning, everyone. As the Premier mentioned, earlier this month we made the very difficult but necessary decision to put in place additional public health measures to prevent our hospitals from becoming overwhelmed. At that time, our government announced that these measures would be in place for at least 21 days, subject to trends in public health and health system indicators. We are now approaching the end of that timeline, and thanks to the sacrifices of Ontarians and unwavering efforts of our healthcare workers, these measures are starting to have an impact. There are some positive signs that we may be reaching the peak of the Omicron wave in Ontario. However, we still need to remain humble and cautious. That's why, as we prepare to safely lift public health measures, We will continue with a gradual and cautious manner that has always guided our decisions. In the absence of concerning trends in public health and healthcare indicators, Ontario will follow a cautious and phased approach with 21 days between each step. Starting with January 31st, 2022, Ontario will begin the process of gradually easing restrictions in effect under the modified Step 2 of the Roadmap to Reopen. This includes increasing social gathering limits to 10 people indoors for social gatherings and 25 people outdoors. Capacity limits will be increased or maintained at 50% for a number of indoor public settings where proof of vaccination is required, such as restaurants, retail, gyms, and religious services. Spectator areas at sporting events, concert venues, and theaters will be permitted to operate at 50% of the usual seating capacity or 500 people, whichever is less. Proof of vaccination requirements would continue to apply in existing settings. Should trends remain stable or improve, Ontario will move to the next step on February 21st. At this time, we will increase social gathering limits to 25 people indoors and 100 people outdoors, and remove capacity limits in indoor public settings where proof of vaccination is required. Spectator capacity at sporting events, concert venues, and theaters will be permitted at 50% capacity. And capacity limits in indoor public settings where proof of vaccination is not required will be limited to the number of people that can maintain 2 meters of physical distance. By March 14th, we intend to lift capacity limits in all indoor public settings and religious services and ceremonies, and increasing social gathering limits to 50 people indoors with no limits outdoors. Proof of vaccination requirements will be maintained. Final recommendations on moving to each step will continue to be based on the recommendations of the Chief Medical Officer of Health, and we are committed to remaining cautious and responsive as we continue to respond to the Omicron variant. As we start to see some hopeful signs and begin to ease measures, I want to remind Ontarians how grateful we are for their sacrifices to keep one another safe. And to our healthcare workers, pharmacists, and other essential workers, it has been a long and difficult road through this pandemic, and it cannot be emphasized enough how indebted we are to you. As I mentioned yesterday, there's no question we will continue to face challenges in the weeks ahead. However, if we remain steadfast in our gradual and cautious approach, as more Ontarians continue to receive their vaccine and we begin to roll out antiviral treatments, and as we continue to use the full resources of our healthcare system, I am confident that we can manage the challenges before us. Thank you.
Before we take questions from the phone, we'll move to the floor first.
Hi, Premier. Matthew Bingley, Global News. Last October, you presented a plan that had a very ambitious opening plan that saw at the end of March the loosening of restrictions to the point where you were saying that masking would no longer be necessary and vaccine passports would no longer be necessary. Under this plan, it appears that March 14th, vax passports are still necessary at that point, and I didn't see a mention on masking. My question to both you and Dr. Moore is, do you think that you were overly ambitious with that original plan, and do you see a point where in cold weather where we see cases rise, such as next fall, that these steps would probably be necessary, the vax passport and masking, to continue?
Well, first of all, back in October, we didn't see the spread of Omicron, and we saw the spread taking off at the beginning of January. That changed the game, and I'm 100% confident that that was the right decision when they gave us the data. And you know, there was 3 things that we had to focus on. First of all, we saw the spread. The positivity rate was 40%. Those are staggering numbers. 4 out of 10 people were getting Omicron. Now we see it drop down to 15.9%, so that's positive. We saw the cases of the hospitalizations, where they were doubling every single week. Now we're seeing that ease. And another big factor was the absenteeism of our healthcare workers, but not just our healthcare workers, other businesses right across the province. So we're seeing a positive trend. We're still very cautious, and I always say we aren't out of the woods yet, but we're taking a cautious approach to move forward. And I'm confident that we're going to move forward cautiously and get things back to normal as quickly as possible.
Dr. Moore, do you have anything to add?
No, I think the Premier's response was absolutely right on. In October, we had no understanding that Omicron would be declared a new variant of concern November 26th. We had a good plan in place for Delta, and thanks to all Ontarians, they were getting immunized. They were following all the basic public health measures to ensure safety in our community. So we've responded to a new variant quite appropriately. Sadly, we've had to put public health measures in play at present to best protect Ontarians and the healthcare system. And again, thanks to all Ontarians for the sacrifices they've made. It's made a difference. Our health system has been able to provide the right care at the right time for any patient with COVID-19. Certainly, we're at capacity in the healthcare system. We've made sacrifices for elective surgeries to be able to provide that capacity, but all Ontarians are receiving the care that's required at present, and thank them once again for their sacrifices. And we have to be adaptive to any new variant, and Ontarians have done that for Omicron. We do see light at the end of this phase of the pandemic, as the Premier has outlined, and we do see hope that the sacrifices have been worth it by the businesses affected. And like any public health measure, they have to have a time-limited place. And now that we've anticipated the health system being able to provide the right care at the right time for all patients in Ontario, we're absolutely prepared to remove the measures in a cautious and gradual, staged and phased approach.
Premier, the CFIB says that 1 in 5 businesses is on the verge of financial ruin and collapse. I know that you've already pointed to some of the supports that have already been presented, but they are saying that even with restrictions lifted, consumer confidence isn't there and they will suffer going forward. What more does your government need to do to add financial support to make sure that they don't collapse?
Well, first of all, my heart breaks for the businesses. I'm a business-minded person, own a business, I get it. I understand how tough it is to meet payrolls and meet the sales coming in and meeting all the challenges, but we've stepped up to tunes of billions and billions of dollars. We just put out a $10,000 grant. We're also making sure that they were taking care of their electricity costs and other areas, support from the federal government as well. Folks, you know, when we get back out there, I encourage you, go in and support your local business. Go out to the restaurant, even at the 50%, please take a night out at least once a week and go to your local restaurant and support them, either takeout or you're able to sit inside. But make no mistake about it, I understand. I fully understand the pain they've gone through, but we'll come back. We'll come back strong out of this. Our economy is strong. I'm going to say it'll be like the Roaring 20s. We've seen 160,000 more people employed right as we speak right now than we did prior to the pandemic. We've created the environment for companies to come from all over the world and open up businesses here. We need more people. We need another 315,000 people to fill the jobs. So I'm confident about the economy. I'm feeling very confident. We're going to cautiously open up, and we're going to get back to normal as soon as we possibly can. I can tell the business owners, I can't stand closing them down. I know the doc knows it. I know the minister knows it. But health is a priority, and I follow directions and advice from our health team, and that's what was able to get us through the last few weeks.
Okay, we're ready to move to the phone lines for questions. First question, please.
from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Premier or Dr. Moore. I'm just wondering, since in the past you've had to kind of pause or delay some of these reopenings, I'm wondering what specifically you would be looking at that would kind of be the tripwire for having to pause or temporarily halt these kind of measures. What are the key things you're looking at?
I'll pass that, Dr. Moore.
Thanks, Rob. So just in particular, it's not one number that we're monitoring. It is a series of data points. As the Premier announced, the percentage of tests that are positive is on the decline at 15%. So that is one indicator we're following very closely. As well, the ability to care for Ontarians in the intensive care unit setting, as well as in the hospital. Thank you to all the healthcare workers that continue to provide care. We're at 100% capacity for the medical and surgical beds, but we are providing care for COVID patients in the right place at the right time. The other metric is the number of outbreaks in long-term care facilities in particular, because patients have to move eventually from the acute care sector back into long-term care or from long-term care back into the acute care sector. So those are some of the metrics that we're following, as well as the ability to care for individuals in the health sector. And the Premier already mentioned the number of people that are not in the workplace because they've called in sick. We're seeing improvement in those metrics, and they're plateauing in terms of the hospital use. We anticipate by the 31st that there will be ongoing improvements, but February will be difficult as well. We absolutely anticipate the need to have continued ICU capacity for patients, and hence the Premier's call to continue to get immunized, to continue to come forward for the third doses will be important every day going forward. 11 days to the opening, and we want a million more Ontarians coming forward. We can immunize more than 100,000 a day. So important that anyone with an underlying medical illness in Ontario get their third dose, especially those that are 50 and older. And there are appointments available across Ontario to do that over the next several days. So please take advantage of the availability of vaccine.
Follow-up?
Yes, thank you, Doctor. You were mentioning that everyone with COVID is getting the care they need, but a lot of people with needing cancer and other surgeries and heart procedures and whatnot are still on this pause. When will you lift that so that hospitals can get more back to normal? And when do you think, under the timelines for reopening, that you'll be able to get back to broader PCR testing than we're having now, with mostly limited to healthcare workers and people at high risk?
Well, it's very unfortunate that we had to provide Directive 2 to pause non-emergent, non-urgent surgeries. If people do have a life-threatening condition, of course, they will still receive the care that they need. But we know that many people are upset and frustrated at having their surgeries pushed off yet again. We want to get back on track with them as soon as we can. But that, as you know, both hospitalizations and admissions to ICU are lagging indicators. So we don't expect the peak of the admissions to ICU to happen until about mid-February, early first, second week of February. So as soon as we can see that the numbers are going down, both in terms of admissions to hospital and in terms of intensive care admissions, then we'll be able to get back on track with those surgeries and procedures, because, as I said, this is a very difficult decision to make, but one that we had to do to preserve our hospital capacity in terms of beds, but also in terms of health human resources. But I will ask Dr. Moore to perhaps comment further on that.
Thank you, Rob. Again, for the testing strategy, we take advice from the expert panel on testing and from our laboratory partners. We do have good capacity within the PCR system to review our testing criteria at present. Again, therefore, the most vulnerable, long-term care facilities, hospitals, those that need treatment, those with comorbidities, and First Nations, Inuit, Métis. But we're regularly reviewing the criteria criteria for PCR testing. Again, this province has also been very aggressive in making available rapid antigen tests, so 3.9 million distributed this week through our education partners. So we're going to try to have a balanced approach between the access to RAT tests, both prioritized, but also having a population level access to RATs as well as to the PCR. So going forward, we want to balance between those two testing modalities. Clearly, the more labor intensive and the more difficult to get, so you have to go to an assessment center, you have to wait, get the swab done. For PCR testing, we're limiting it specifically to those high-risk populations and settings. And I hope the public, as we have more RATs generally available, will take advantage of them, because I do believe they're much more convenient, done in the calm of your home, and you have an answer within minutes instead of waiting several days for the PCR results.
Next question.
Your next question comes from Richard Southern with City News 680. Please go ahead.
Hi, Premier. Good morning. Premier, you said at the beginning of the month that restaurants, gyms, and movie theaters were closing to protect hospitals. Can you then tell us today why restaurants, gyms, and movies are reopening before elective surgery is resuming?
Well, I'll just repeat what I said earlier on, Richard. There was 3 areas of focus. Number one is when we saw the hospitalizations double every single week. We saw the positivity rate go right up to 40%. Now we've seen it drop down to 15.9%. And everyone saw the absenteeism in your own workplace, not to mention the healthcare sector. You know, and we're doing everything we can to make sure we bolster the healthcare system. Keep in mind, folks, I'm going to go back a little bit here. The Liberal government fired 1,600 nurses. Our healthcare system was not in good shape when we took office. Since then, we've hired over 6,700 healthcare workers. We're going to be bringing in another 6,000 in March. We're putting billions and billions of dollars into the healthcare system. We want to make sure that we're prepared for any future pandemic. We've put in tens of billions of dollars into infrastructure and building new hospitals right across this province, and we're going to continue to invest in our healthcare. But we can't do it alone. No province can do it alone. Since I've been elected, we've been on the federal government for the CHT, the Canadian Health Transfers. We are paying, as Ontarians, 78% of the cost. The federal government, and it's not just this federal government, it's prior federal governments, I don't care if it's Conservative or Liberal, they're pitching in 22%. That's unacceptable. Every single Premier is in line with making sure that the federal government pays their fair share of health care. And it's not one-time funding that we're looking for. We need continuous funding, nonstop, until we can hire more health care workers, until we can take care of our nurses, until we can continue bringing in new technology and building new hospitals. But I can tell you every single Premier is in line on this. We're going to have a meeting today with all the premiers. We need the federal government to step up. It's very simple. We will not be able to move forward, not only as a province, as a country, with the federal government pitching in 22% and putting the vast majority of the burden on the backs of the provinces.
Follow up?
Okay, follow up for Dr. Moore. Dr. Moore, there's a letter posted online appearing to be from you addressed to the Niagara Region Chief Medical Officer of Health, in which you, quote, express concern with measures he's taking with schools in that region, including weekly CO2 monitoring in classrooms, the dismissal of cohorts if there's a positive case, and the use of medical exemption notes for masks. Is that letter accurate, sir? Cannot local medical officers of health make their own decisions? And Dr. Moore, what's so wrong with these measures?
So we meet with our medical officers of health on a regular basis. We have consultation to them from this office to local public health, and I thank all the local public health officials for all their work they're doing to protect the health of their communities, both through vaccination and case and contact management and outbreak management. What I'm trying to have across Ontario is a consistent and persistent approach so that parents, school boards, families can expect the same level of protection and care. And so I did have a conversation with Niagara to understand a different approach approach. That medical officer of health informed me of why they're making them, and that dialogue continues. And I have the similar dialogue with health units across this province through my regional associate chief medical officers of health. So I think all Ontarians should be assured that we're in regular partnership with our local public health agencies, that we communicate, we collaborate with them, and we try to ensure consistent and persistent approaches across Ontario.
Next question.
Your next question comes from Kelly Botello with CHCH News. Please go ahead.
Hello, this question is also for Dr. Moore on the same topic of that letter that you sent Dr. Hirji. What are your biggest concerns with those measures that the Niagara Health Unit is implementing, and how Dr. Hirji is managing the return to school?
So the consultation that we had with his office was basically about the public health measures that are in place and the return to school. We want consistent and persistent messaging across Ontario. We have reviewed the science table's recommendations, the importance of the mental, physical, social, and educational needs of our students, and the desire to keep them in the classroom as much as possible. And some of the recommendations that he had put in play could have increased the amount of absenteeism of students. So it seemed to go contrary to the recommendations of the science table and our pediatric experts and our education experts. So I just sought clarity from the medical officer of health. I also sought clarity on some of the recommendations and policies that they put in place in a workplace, given that schools are a workplace for teachers and jurisdictionally, public health physicians typically don't get involved in workplaces. That's more Ministry of Labor. So the purpose of the communication was to seek clarity, to seek ongoing consultation, and to be supportive of our local medical officers of health, which we try to coordinate regular meetings, and this issue had not been brought up with us in the past.
Follow-up?
Thank you. And do you think, or would you encourage people to dine in at restaurants or work out at gyms when the restrictions do loosen?
So there are safety measures that are in place in all of the restaurants and all of these facilities, including masking, distancing, hand hygiene, and point of visit verification of immunization status. So all of the measures that we've put in place will remain. We do believe a safe and cautious opening at 50% capacity will build confidence in Ontarians and decrease the risk. We think it's proportionate to the risk at present. And as the Premier has said, we need to have a balanced approach that recognizes the importance of someone being able to keep their businesses open, to generate a living, to have a place of employment against the risk of this virus. And I do think it's proportionate and balanced to have them open on the 31st with the measures that we put in place across all these workplaces, which ensure the best safety that we can given the infectiousness of this virus.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Premier. With businesses that require proof of vaccination set to reopen soon, are you looking at all at updating the requirements for the vaccine certificate to 3 doses from 2?
Not right at this point.
Follow-up?
All right. I'm also wondering about long-term care restrictions. Are you looking at easing any of the visitor restrictions in long-term care?
I'll pass that over to Dr. Moore.
So it would be up to the Ministry of Long-Term Care to make any changes in any of their directions. We consult with them, and any removal of measures that have been put in place would be proportionate and balanced to the risk. The risk still remains relatively high. We clearly are seeing a number of outbreaks across long-term care facilities, both in positivity in workers as well as in their clients and patients. And I think it's prudent to keep those restrictions that are in place until we see significant improvement in the transmissibility and activity of Omicron in our community. So please bear with us. Thank you for the sacrifices you're making. We know these have an effect on the well-being of some individuals in these facilities, but we also need to balance those with the risks of transmission in those facilities. So we review them on a regular basis and ensure that we remove them in a timely and safe fashion, and meet with the Ministry of Long-Term Care on a regular basis with a formal meeting every Friday afternoon to review all measures.
We'll take our final question from the floor.
Mr. Premier, this is a question I've asked whenever there's a trauma. This is a question I've asked a lot of premiers. Right now, there's an incident happening in Brampton and Mississauga that is very tragic. First of all, your thoughts, and then how can you reach out to the community that's traumatized right now?
Yeah, they just briefed me literally before I walked in the door. My heart just breaks, you know, for the family and the whole community. What a tragedy it is, and we'll be there. I'll speak to the mayor, Patrick Brown, today, reach out to see if there's anything we can do. But what a loss. It's terrible, absolute terrible.
Thanks, everyone.
Okay, thank you.